USMLE, Step 1. Year 2024, number 1110. A 24-year-old male had a headache, malaise, and low-grade fever for the past 4 days. He was brought to the emergency room this morning after he started behaving in an unusual manner and experienced difficulty in speaking. While he was being transported, he suffered a generalized seizure. Physical examination showed a fever of 103 degrees F and total disorientation. Deep tendon reflexes were exaggerated, and the plantar response was bilaterally extensor. He had mild neck stiffness and the optic fundi showed early papilledema. A lumbar puncture produced clear CSF under an opening pressure of 300 mm. H2O. Protein was 160 mg per deciliter, glucose 66 mg per deciliter, blood glucose 90 mg per deciliter, and there were 32 mononuclear cells per microliter. No PMNs were present. Which of the following is the most likely cause of this man's condition? A. Meningococcal meningitis. B. Spontaneous cerebral hemorrhage. C. Herpetic meningoencephalitis. D. Subarachnoid hemorrhage. E. Meningioma. F. Glioblastoma multiforme. A characteristic of meningitis is the rapid onset of symptoms, which may result in death within only a few hours. The first symptom of meningitis is usually vomiting. A severe bursting headache or fever develops when the meninges have become inflamed and the pressure of the cerebrospinal fluid (CSF) has increased. Altered mental status, neurologic deficits, and seizures are signs of increased intracranial pressure. Papilledema also indicates increased intracranial pressure. Stiffness or pain of the neck then develops, owing to irritation of the spinal nerves supplying those muscles. Deep tendon reflexes are exaggerated, and convulsions may occur in infants and small children. In more severe cases, the CSF becomes so thickened by pus that the passages between the ventricles of the brain and the spaces in the spinal meninges become blocked, causing fluid to accumulate, resulting in hydrocephalus, which causes coma and death unless relieved. Lumbar puncture findings. Clear CSF under an opening pressure of 300 mm H2O, increased pressure. Consistent with inflammation or infection. Protein 160 mg per deciliter, elevated. Disruption of the blood-brain barrier or increased production of protein within the CNS, common in infections. Glucose 66 mg per deciliter with a blood glucose of 90 mg per deciliter. Normal CSF glucose is about 2/3 of blood glucose, so it is within normal limits. It suggests that the causative agent is less likely to be bacteria that significantly lower CSF glucose. 32 mononuclear cells per microliter, lymphocytic pleocytosis, and no PMNs, polymorphonuclear leukocytes. It typically suggests that the causative agent is virus. The answer is C. Herpetic meningoencephalitis.